At Breastlink, we offer an extensive list of services provided by our team of dedicated breast specialists. Under one roof, we provide surgery, oncology, imaging, research, plastics and reconstruction, to volunteer services. We have it all. Breastlink Laguna Hills is a comprehensive breast center and the first center in South Orange County to offer low-dose 3D mammography. Our convenient location is accessible by Laguna Woods Shuttle, which stops right at our front door. Whether you need us now or later, we're always here.
And welcome back. Well, today we have a couple very interesting guests on, and one of them I think came on before, right? Dr. Lisa Curcio.
Yes.
From Breastlink. Nice to have you back.
Thank you for inviting me back.
Yeah, it's great, and you folks are located very nearby here over
Absolutely.
in Laguna Hills. You brought along a very special guest here, and someone that you've been working with for quite a while. And I think it's great that you were able to do so. She even wrote a book. Deanna Rice, we'd like to welcome you today.
Thank you.
And we're going to talk about this book in just a moment. First, tell me a little bit about Breastlink. If people didn't see, you were on a while back, but give us a little overview of what it is.
At Breastlink, we're a multidisciplinary center for breast cancer or breast lumps, any breast symptoms. We actually work together in one office space with our imaging counterparts, our breast radiologist. We work with our medical oncologist, myself, the breast surgeon, and a reconstructive surgeon, all in one location. So a person can walk in there with a breast symptom, get their imaging, see the surgeon, God forbid if it's something that's more serious that needs additional care, and see the medical oncologist and see our plastic reconstructive surgeon and even our social worker. We have a patient navigator. So we have everything along every step of the way that they need under one roof to take care of a woman's needs when it comes to their breast.
All right, very good. Now, do you work with, obviously in this community, we have a lot of people with on Medicare and things like that. Do they need referrals to come to you, or they can just come over there?
No, absolutely. Medicare patients can be referred by their doctor, but they could be self-referred too. We see lots of patients.
Very good. One of the things that you do, and we've heard about this before, but I want you to go into the benefits of genetic testing. It's something that I've heard about before. Quite often, it's done when someone is younger, a woman who's pregnant. Sometimes they go, well, you want to do genetic testing. That's where I've heard of that before. But you take it much further than that, and it's something that at any age can be done.
Well, for many years we've been doing genetic testing to make sure, that children don't have, genetic disorders that they need to be treated for early on. But more recently, over the past decade and a half, we've been looking at the genetics of cancer. And we're understanding that there are more and more cancers that we may have been born with a genetic predisposition, especially when we see young women with breast cancer, or we see families with multiple women in that family, multiple generations that have had some sort of cancer and been affected by cancer. So as we understand more and more the genetics, now we can start testing for particular genes that might predispose someone. And that's both important for someone who has cancer because the risk of a second cancer might be very high, much higher than someone who doesn't have a genetic disorder.
Yeah.
So it might change how they manage this cancer, but even more importantly, for someone who doesn't have cancer, to prevent a subsequent cancer. If we can identify that they're predisposed, we can take measures to prevent those cancers.
So this is something that can be done for folks that are perfectly healthy, and they just want to find out, maybe they have a family history, and want to find out, are they predisposed for this? Men as well?
Absolutely, absolutely. When we first started doing genetic testing for cancer, we were focusing on the BRCA1 or 2 gene that's associated with breast and ovarian cancer, and a lot of the emphasis was on women. But we know that men are at increased risk for prostate cancer and male breast cancer. So we started testing our male breast cancer patients. Currently in the United Kingdom, there's a large trial looking at men who have the BRCA2 mutation because they have an 8-fold increased risk of prostate cancer. And they're identifying healthy men that have that mutation, and some of those men are undergoing a preventative prostatectomy to prevent the cancer, because those men are more likely to die from with that mutation.
Wow, interesting.
Isn't that interesting?
What about people that were, years ago, they were adopted? Maybe they don't know who their parents were. They don't have family history that goes back very far. Maybe or maybe it just goes back one generation. Can you help with that?
Absolutely. If someone has a cancer, if they are adopted or they don't know anything about their biologic roots, we can get them genetic tested on just that basis. We have no idea what their family history is. I think the more challenging person is someone who, maybe has half their family, they were estranged from their father at an early age, or their mother for that matter, and don't know anything about 50% of their genes. That's a little more challenging. And so insurance companies initially were not real lenient with that, but as we demonstrate to them that we don't know a lot about half of their family history, they're now getting more and more willing to do testing on some of those patients. But it is on a case-by-case basis. Insurance companies have a certain set of criteria through which you have to meet some of those criteria to be able to get the testing covered by insurance companies.
Very interesting. It's nice that this type of testing can be done, and I can see the incredible benefits that it can bring, just to have that knowledge.
Especially in the arena of cancer prevention.
Yeah.
I mean, really a powerful tool.
Well, Deanna, you've gone through this experience. You've had the experience with genetic testing. You've also dealt with being diagnosed with cancer on multiple times. Tell me a little bit about your story and when were you first diagnosed with cancer, and what type of cancer was it?
I was diagnosed the first time with breast cancer when I was 29 years old. I had just given birth to my third child, and he was about 8 months old, felt a lump, and was told that I was too young, not to worry about it. And I didn't. I was treated for the breast cancer. I didn't worry about it. And that was right when they had just started talking about genetic testing and said I wasn't eligible for it. So that was back then. That was, things have come super far from then. I went on to have another child, and the same thing happened. She was months old, and I was diagnosed with another breast cancer on the other side. And at that point, I was scared. I wasn't sure what was causing it, whether I was causing it myself, whether I didn't like myself, and it was manifesting. I mean, I was digging into everything I possibly could. Unfortunately, I met Dr. Curcio on a television show that I was producing, and I was doing a pre-interview with her and was talking to her about, oh, I'm a 2-time cancer survivor. She was like, what? Have you been tested? And I was like, no, I haven't tested. I don't qualify. She's like, you qualify. You've had 2 breast cancers. And I said, yeah, but I don't have any family history. She said, well, first of all, it doesn't matter. You've had two personal cancers. She said, just humor me. Tell me who in your family's had any kind of cancer. And I said, my paternal grandmother died of breast cancer. She's like, Deanna, you have to be tested. You have to be tested. So it took me a little bit, and I went in and I was tested and came back positive. And for me, it was absolutely life-changing. My whole mental state changed into, this is science. This is something that's passed down. This isn't something that I did to myself. And we went in and we did the preventative surgeries. And, if I had run into her a year earlier or 2 years earlier and she had told me the same thing, my outcome could be significantly different. But because of when it happened, I went in, I had a preventative hysterectomy, and they found a stage 3 fallopian tube cancer that was undetectable.
Wow.
So only because she diagnosed me with the gene did I go in and have the prophylactic hysterectomy. have everything removed, and was diagnosed with cancer again.
Wow.
And it's absolutely saved my life, because I would never have known that I had no symptoms whatsoever of cancer, and it was already spreading rapidly.
Wow, that is it's quite a story.
It's quite a story.
And how did this affect your family? You have how many children?
I have 4 children. It has affected them quite a bit. I mean, they've all grown up now with a mom who's been diagnosed with cancer, the youngest one certainly for her entire life. And the one thing we have now that we didn't have is testing. And I have had all of my children tested. My oldest one just turned 30. When she was 25, she was tested. She was absolutely the one that felt that she had no life ahead of her. Her mother had breast cancer, and she was going to die of breast cancer. She was getting up to the same age where I was diagnosed with breast cancer. She had pretty much given up.
Yeah.
And finally got her talked into, "You're different than I am, test." She tested, she came back negative. It was an amazing, amazing moment in our lives, because at that point she said, "Mom, I can have babies." She had shut everything down.
Yeah.
So we know that for 3 of my 4 children, they don't carry the gene. The one that does carry the gene is a male, and we can watch him closely. But it does take a huge weight off of the girl's shoulders. And like she was saying, it does affect men. My dad has the BRCA gene also, so I got it from him. And now my son has it from me. So it's really helpful to have that information.
And you wrote a couple books about
did.
this. Fight Like a Mom is one of them, and then My Cancer Mommy is another one.
Yes.
And was this? Tell me what was the reason you did this? Was this almost like a therapy for you?
It was an explanation to my kids of what had happened physically, mentally, medically, and it was also reaching out to all of those women that contact me and wonder how I can do it. I have people that say, "I don't know how you could do it. I wouldn't be able to do it." Well, yes, you would. You would just go on and you would do it. You would do what you needed to do. When you have great doctors and you have information, you're able to continue on and just do what you need to do. Those kids looking at you, grandkids looking at you, you want to spend as much time with them as you can, and so you do everything possible.
Doctor, when someone does test positive for the markers, the genes, whatever you might call them, what can they do to sort of prevent the cancer for coming? Are there different steps that can be taken? Maybe they're very young, like like your daughter's. Did you say is 25?
She's 30 now. Yeah.
Okay, she's 30 now, and they see that they have this gene in them. Is there something that they can do to prevent cancer coming on? Is it inevitable? What can be done?
Well, we know that women who test positive for the gene, their risk could be as high as 90%, depending on which of the BRCA mutations they have. But there are preventative things we can do. For instance, for the people who don't want to be very radical and do preventative surgery, we can do very close observation. We can do lifestyle management. We know that there are lifestyle factors that may cause this gene to go on and produce the cancer. And there are medications that we can give. Something like tamoxifen has been shown to be beneficial in preventing cancer in people who are genetically predisposed. And then obviously there's what like Deanna did and Angela Jolene, preventative surgery, which has a 90% risk reduction for the cancer, both with the breast and the ovarian. And now in the United Kingdom, as I mentioned earlier, they're looking at potentially preventative prostatectomy and preventing the prostate cancer. So we have lots of interventions. It doesn't have to be radical. It could be more middle of the road if that's what the patient wants to pursue. But the important thing is identifying it and then making a decision how they want to treat it.
We've heard about certain kinds of vaccines that are out nowadays. Cervical cancer is one of them.
Right.
Do you see, with all the testing that's being done now, the advances, do you see a time when, just like, when a baby is born and, in a week they get a few of these different kinds of vaccines, do you see a time when there's going to be more vaccines available, or are cancers, depending where they are and the type they are, so different that it would be pretty hard? You'd have to take 20 different vaccines.
Well, that's right. There won't be just one vaccine for breast cancer. But I believe that the future is very bright for vaccine therapy for certain cancers. As we understand more and more, the genetics or the biology behind why a cancer occurs, I think we'll be able to treat it with things like a vaccine. But it really is understanding why the cancer occurs. For instance, not 100% of people that have this gene problem develop cancer. So why don't they develop the cancer? Is it a lifestyle thing? Is it an environmental thing? We really need to sort out those factors and then be able to administer something preventative.
Yeah. Well, it's good that at least we're moving into that way. Deanna, where is this book available? Can people buy this online?
My website, Amazon.com, but my website's usually
and that's
the
just
most fun way to get it.
DeannaRice.com, right?
DeannaRice.com.
And it's the website's very good. It tells your story
Yeah.
on there, and a lot of good information.
I have a letter to other people in the position and kind of give them some tips and pointers on what to expect and what not to expect from themselves.
Yeah.
Which is a big thing when you're
Yeah, I can see how that would be. But this is a great book, and as I said, all the genetic testing is certainly worked for you.
Oh, my
and I
goodness.
can see why it could just help just people in general. And if somebody like myself, as far as I know, there's not cancer in my family line at all that I know of. Would I benefit from it? Is it just a good idea?
No, I think if we really do have to be somewhat selective in who's actually tested. And if you have a family with lots of women in it and lots of family members, and there's no cancer, then I think it's reasonable to say that there probably isn't some genetic issue. But it's families where, dad was an only child and mom had one brother. Those are families that we call truncated. There's not a lot of family members. So if there is some gene, it's not going to be seen unless you go back multiple generations.
All right, good information. Thank you both for being here.
Thank you for having
great
us.
story, and good luck with you.
Thank you.
I think it's really inspirational that you wrote these books as in the reason you wrote them as a way to explain to your kids, and really great. Check out Deanna's website again, DeannaRice.com. It's very simple to remember. Breastlink.com for more information if you think you're a candidate for genetic testing. Their number is 949-770-0797. They're right nearby over here in Laguna Hills. Thank you both for coming on. We'll be right back.
At Breastlink, we offer an extensive list of services provided by our team of dedicated breast specialists. Under one roof, we provide surgery, oncology, imaging, research, plastics and reconstruction, to volunteer services. We have it all. Breastlink Laguna Hills is a comprehensive breast center and the first center in South Orange County to offer low-dose 3D mammography. Our convenient location is accessible by Laguna Woods Shuttle, which stops right at our front door. Whether you need us now or later, we're always here.